Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Welcome to The Coalition. This is a show about health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave, Atlanta Bariatric Surgeon. I am extremely grateful to have on the show today Dr. Erin King-Mullins. Dr. Erin King-Mullins is an accomplished colorectal surgeon based in Fayetteville, Georgia. Right on time for Colon Cancer Awareness Month, Dr. Erin King-Mullins is here to let us know what we need to know about colon cancer, which is a disease that affects so many. Dr. Erin King-Mullins, thank you so much for joining the
Hello.
coalition.
Hey, good morning. So excited to join you today. Thanks for putting out the call.
Awesome. So let's get started. Can you please tell us about yourself?
Yes, well, I am a colorectal surgeon. I'm actually a double board certified general surgeon and colorectal surgeon. I went to medical school at Emory University and I did my residency back at home in Orlando in the Orlando health system. Strangely, I thought I was going to be a trauma surgeon after having so much fun on my surgical rotation and at Emory down at Grady Memorial Hospital. But quickly changed my mind that I wasn't going to do trauma, didn't quite know where I was going to land after that, thought I was probably just going to be a general surgeon, and had the fortunate opportunity to rotate with some excellent mentors and surgeons in our colorectal specialty down there. And here I am. So I came back to Atlanta for my fellowship within the Northside Hospital system. I stayed on there for about 7.5, 8 years. And then last year took a crazy leap of faith and started my own practice.
Well, congratulations on having your practice. That's amazing.
Thank you.
So let's jump right into it. Can you please let us know what is the impact of colon cancer in America? You know, the prevalence, the incidence, what do the numbers say?
Sure. So, when we look at, so there's a way we have to look at numbers, right? And a lot of times people don't necessarily understand statistics, or if they don't know where these numbers are coming from, they may not necessarily truly understand their risk. So, while if you look at women and then you look at men, um, colorectal cancer is the third most common cancer. But if you bring both populations together, colorectal cancer is actually the second most common cancer. And that's the difference. And the reason for the breakdown, is mostly because, women tend to get breast cancer, men tend to get prostate cancer. And so when you consider those individual populations separately, that's why you see so much of a push for those separate things and they're targeting that population. But when you bring all of us together, colorectal cancer is the number three colon cancer and the number two killer of cancers. And it's totally preventable. And that's why it's such a huge deal, because we know this is a completely preventable malignancy.
Wow. So when you say it's completely preventable, can you talk a little bit about the risk factors, particularly as it pertains to family history?
Yes, that's a great question. A lot of people who I talk to about colorectal cancer screening, number one, the age for recommended screening has decreased. The U.S. Preventative Services Task Force decreased the recommended age for all comers from 50 years old to 45 years old back in 2021. So that's my first hurdle, is really just letting providers and patients know that the new age is 45. Secondly, so you get someone and they're like, oh no, I don't have a family history, I'm good. Well, that's not true. The number one risk factor is age. So just like we know after a certain age, we start getting, again, the breast examinations and the mammograms, we start getting the prostate examinations and labs. The number one risk factor is age. So only about 10 to 15% of colorectal cancers are actually linked to a family history. So that means the other 85-90% is just, we live long enough. Unfortunately, things can go wrong, and we're seeing it younger and younger. And the important part of this is now, yes, while the most important risk factor or greatest risk factor is age, if you combine a family history of, number one, not only colorectal cancer, but also polyps, and we'll talk about that. But polyps is a precancerous state. Now that's family history. So now we definitely know once you get a little bit older, if you add that age factor plus that known family history, that's a double whammy. And so we need to be more aggressive, and you may need to start your screening examinations earlier and have them more frequently.
Mm. That is really useful information, especially the part about spreading awareness that the age had decreased
Yeah.
for screening.
Hmm. Hmm.
So, as I counsel patients, are you up to date on your screening colonoscopy? One question I get is Cologuard. Can you
Hmm.
give some insight into where that fits in to the screening process, or if it fits into the screening process?
Sure. So there's different options for screening. There are what we call our invasive and non-invasive tests. Now, I am getting screened in any way, shape, or form, right? So whatever is good for you, and is best for you and your health and your current, socioeconomic situation, all of those things, then do what you have to do. However, the biggest difference with the colonoscopy in and of itself is that it's both diagnostic and therapeutic, meaning if I see something, I can do something about it right then and there.
Hmm.
Doing the stool-based tests like the Cologuards and the FIT tests and the fecal occult blood tests, or the imaging varieties like the virtual colonoscopy via CT, if those detect something abnormal, you have to follow up with a colonoscopy to figure out exactly what's abnormal. So that's the first thing. The second thing is the fact that not everyone is a candidate for that. And so you specifically asked about Cologuard. We'll talk about the fact that if you do have a family history of colon cancer or polyps, or if you do have any symptoms at all, then you are not a candidate for that test because by definition, you're at a higher risk of having something abnormal. And so the tests may not detect that.
Hmm. The other question I was going to ask about is, are you, in your experience, have you heard of any hurdles that hold people back from getting colonoscopy? Every now and again, a patient
Mhm.
will say to me, well, I've heard there's a risk someone's bowel can get nicked. Can you kind of talk about the
Sure.
safety of colonoscopy?
Yeah, that's a great question. And, that's something that I have to deal with all the time, and rightfully so. A lot of times, so in our eyes, as medical professionals, we tend to see colonoscopies as routine examinations, right? We don't necessarily really consider the risk. It's more of a minor procedure compared to, some of the bariatric procedures that you do and some of the more advanced colorectal surgeries and procedures that I do. And so we kind of can sometimes take it lightly. But a patient who knows a friend or a coworker or a family member who may have had a bad experience, they may have had a difficult colonoscopy, they may have had, again, an injury. That's what they hear about. They don't hear about oh, I had a great experience. I went and had my colonoscopy and it was great and it was fine and I'm good for 7 to 10 years. They don't hear all that. What stands out are those outliers. And so what
Right.
I say to them is that number one, while there's a risk, there's about a 1 to 2% risk of perforation of the colon. Now it's not zero, but compared to the thousands of colonoscopies that are done across the country daily, that's relatively small. But also, when we hear these stories, we don't know the whole picture. We don't know if the patient had any other risk factors, if the prep was clean, if they had prior surgeries and scar tissue, whether or not, they had, a mass or a cancer that was found. Kind of. So there's so many things that go into those scary tales. And so what I just tell people is to really be open and honest about the conversations that they have with their physicians, so their physicians can understand their fears, and so we can address those specifically to know what may be holding you back from getting the procedure. um, and then kind of along those lines, there's not only the fear factor of injury or bodily harm, there's the fear factor of finances, right? um, money is tight for a lot of people these days, especially if you have a family, especially if you have to take off work to have the procedure. You actually have to have a driver, so you may be potentially asking someone else to take off of work. So those are conversations to have with your provider so you can understand what's the best way you can get it done. If you're truly getting it done for purely screening, those are covered by your insurance providers, like preventative services, like your mammogram and your annual wellness visits to your physician. So the other
Mhm.
part is not only having the conversation with your physician, but make sure you're really attuned to what your coverage is.
Mhm.
And you may not have to pay anything at all out of pocket for the procedure.
All right. So, for folks watching who have never had a colonoscopy, can you let them know what to expect? What do they have to do before and then the day of?
Okay. And for this, I'm just going to basically talk about what we say is the usual straightforward screening patient, right? With no symptoms, no prior medical history that we're really concerned about, no medical problems. So it's a little bit of a 2-day preparation before the procedure, but sometimes there's certain things that you may have to do a week in advance to prepare. If you're on certain medications, if you're on certain diets, we may have to change or stop those in advance to make sure that the formal bowel preparation is adequate. The day before the procedure, you're going to be semi fasting. So that means no solid foods. So that whole day, you're going to be drinking clear liquids, juices, broths, jellos, Gatorades, Powerades, anything that you can see through. Um, then later on that afternoon, evening, you're going to start taking a prep, which is a laxative. There's several types. There's prescription versions, there's over-the-counter versions, and so your provider who will decide what you need based upon, again, your medical history or what they've had the best experience with, and then also based upon the time of your colonoscopy the following day, because obviously you can understand someone who's having one first thing in the morning may need a little bit of a different preparation than maybe someone who had it later in the day. They need to split it up a little bit. The next day of the procedure, you're going to come to the facility where you're having it. Most places will go ahead and let the nursing staff insert an IV, and someone from the anesthesia team will come talk to you and prepare you for what's about to happen. You will get sedation. So, again, typically this is done under IV formulation of sedation. So it's not general anesthesia. You're breathing on your own and all of those things, and you come to pretty much right away. But again, every facility is different for the medications that we provide. But because you get that medicine, you cannot drive yourself home. Light activities the rest of the day typically can go ahead and restart your regular diet right then and there. Mostly you can resume your pre-existing medications. Again, unless there's blood thinners involved and there's biopsies involved, there's going to be specific directions provided to you on how to resume those medications. And then the day after your surgery, I prefer to call it a procedure, then that following day, you should be able to return to your normal activities, go back to work, whatever you need to do.
Perfect. Well, thank you so much for providing that insight because hopefully this information is really going to save lives. One question I had is we talked a little bit about risk factor for colon cancer with age being the main one.
Yes.
Um, is there, and I know weight is also a risk factor. That's kind of the overlap between colon cancer and obesity. But are there particular foods or diets that you think increase the rates of colon cancer?
Yes, and a lot of those things are not end all be all. Like if you do this, you will get cancer, but there's associated risks and things can compound on themselves. So some
Mhm.
of the toxins that we know about that we commonly utilize, that some people use, smoking, heavy alcohol consumption, those are some of the giveaways. But diets that are high in red meat, high in processed foods, low in fiber, those are things that contribute to the risk. And part of it is the way our body works. Literally, if we take it all the way back to some of the basic science and things that we learned about in college and medical school, we need to have diets that are higher in fiber. So your fruits and your whole grains and vegetables, because the way that fiber is broken down in the body, it literally breaks down to the fuel that feeds the colon cells to keep them healthy. And if you consider foods or diets that are high in red meat, the way that your body breaks that down, it literally breaks that down into formulations that are toxic to the colon cells. Now,
Mhm.
I'm not saying stay completely away from those things. We got to be able to enjoy life, but we all know in moderation. We all know, we have to, um, just take everything uh, again, like I said, in moderation, and just understand there are risk factors, but you are able to enjoy yourself. Just make sure that we are staying on top of what we know we should be doing. And hey, I'm one of the biggest ones. I know I should exercise more. And believe it or not, exercise is actually linked to colorectal cancer prevention. And when you think about it, our intestines have muscles in them, just like the rest of our body, to squeeze and propel our waste forward to evacuate. And so being able to increase your activity to increase that blood flow is thereby going to bring by the natural nutrients and things like that to those organs, just like anywhere else in your body.
Right. You're absolutely right. This is the second episode of the coalition. I was fortunate to have Dr. F. Michael Toka, cardiologist, for the first episode.
Yeah.
And it's amazing how the things that are good for the colon also are good for the heart. So that's good that there's a lot of consistency. He talks about exercise, red meat in moderation, and avoiding smoking and excessive alcohol. So it's good that we can live a consistent lifestyle that's going to be healthy for us overall.
When you think about it, and I think that's the point of having these conversations and having it repeated, because I think sometimes people can get overwhelmed and they're like, oh, I gotta go do this for my heart, and then I gotta do this for that. There's a lot of overlap of all of it. And so one of the biggest things, and I'm sure you work with nutritionists and dietitians all the time, just like I do, one thing I do tell people is, again, check with your benefits and whatever you have available. And if you have the ability to see a dietitian or a nutritionist, so you can come to them with all of your medical problems or concerns, they can help lay out for you, exactly what you need, and actually further enforce the fact that what you do for one is, what's good for the goose is good for the gander. It can help so many different body systems and processes.
Absolutely, a holistic approach.
Mm-hmm.
So, we talked a lot about screening and the risk factors. What are some things that we should be on the lookout for that we may have colon cancer? Are there specific things that a patient may experience that they need to ASAP look into?
Definitely. And the first thing that I'm going to say before we even jump to symptoms is talk to your family, right? So talk to your family, ask them specifically about any known history, number one, of colon cancer, but also colon polyps. And then you sometimes after that have to take it a step further and talk about any cancers that run in the family, because there's sometimes different syndromes that can link different types of cancers together. So the first thing is just to have that conversation, right? And then next, being attuned to your body. And the craziest thing, well, not crazy, but, one of the things that, I talk to patients a lot about is the symptoms for colorectal cancer are not specific. They're very generalized. And so just because you have one thing doesn't guarantee you have colon cancer. And so we have to pay attention. So changes in your bowels that can't be linked to, dietary changes, or, if you had a stomach bug or an illness, something that changes that's persistent. Change in the caliber of the bowel movements. If you're finding that they're consistently thinner, or you're having difficulty passing the bowel movements, abdominal pain, rectal pain, bleeding, changing in the color of the bowels. Again, all of those things that are linked to not a specific trigger, like you didn't change your medicines, you didn't start a new diet, you didn't start a new workout plan.
Right.
And then weight loss that you did not intend to lose. Some people are like, yeah, I lost some weight, and I started my clothing size started decreasing. Well, was that something that you tried to do? Because that is one of the hallmark symbols of just chronic disease in general. So that could be cancer, but it could be other things that, your body's metabolism is focused on that illness and not your necessarily health and building blocks for your health and your muscle and all of those things. And so unintentional weight loss is one of the keys as well.
Okay. Well, yeah, that is all just super important information, because we all have to pay attention to our bodies and listen to our bodies and kind of know when something may be awry, so that we don't lose time in terms of having something addressed. So thank you so much for that. This has been amazing. I know you're extremely busy, and so thank you so much. I know that this information is going to save lives. What is the best way for patients who need your expertise to contact you?
Yes, they can go to our website. So the name of my practice is Colorectal Wellness Center, based in Fayetteville, Georgia, which is in the Metro Atlanta area. Our website is colowellness.com. That's COLOWELLNESS.com.
Awesome. Well, Dr. Erin King-Mullins, thank you. You are now officially a part of the coalition. I'm hopeful that you'll come back another time. Did you have anything else that you wanted to let everyone know for Colon Cancer Awareness Month?
Just wanted to reiterate, have those conversations, talk to your family, talk to your provider, figure out what you're at risk for, because if you don't know, you can't do anything about it. And there's a litany of providers that can help get you there.
Awesome. Thanks,
Thank
everybody, for
you.
watching.